So coming to our second round. So coming to the rules, a set of questions either in the form of video, we have team F joining. I think they have left. Okay. A set of questions either in the form of video or image will be displayed for each team. You have 15 seconds to answer each question. Incorrect answer will or time up will give you 0 points and the correct answer will fetch you with 1 point. Decision of the quiz master will be considered to be the final decision. So we'll now start with team B. Team B, are you all ready?
Yes, ma'am.
Okay. So your first question is, you have to identify this special test.
Yes.
And draw a test.
Sorry?
33.
Can you repeat your answer?
Latchman's test.
That's the right answer. Good. Your next question is, identify the equipment used. Your clock is ticking.
Ankle brachial index.
That's the wrong answer. The right answer is, it is the blood flow restriction machine. No problem. We'll go ahead. Identify the part of the unit pointed by the arrow.
ह्याच्यामध्ये असतं
Clock is ticking. Team B. Time up. Team B, the time is up. The right answer is, it's a wooden clit which is used in a setup of suspension therapy. No problem. We'll go to the next question. Of which condition can the X-ray likely be of?
line of
Hydronium orthodox.
Do we have an
pleural
answer?
effusion.
Sorry?
Pleural effusion. Pleural
No,
effusion.
you were very close to it. The right answer is hydropneumothorax. No problem. So with this round, team B has scored 1 point. No problem. We'll go to the next team, that is team C. Team C, can you unmute yourself?
Yes, ma'am. Yes.
Okay. Team C, your first question is, identify the special test.
It is supraspinatus test. Supraspinatus test. Empty can test.
Perfect. That's the right answer. We move to the next set of questions. Identify the instrument used.
It
The
is
clock is ticking. Team.
pulmonary function.
Do we have an answer?
No, ma'am.
Time up. The answer is, it's an isokinetic training machine. No problem. We'll go to the next question. Identify the part of the unit pointed by the arrow.
IRR, infrared radiation.
That's the instrument.
Mesh
We want
network.
you to answer by the arrow.
The mesh network.
The right answer is, it's a parabolic reflector. We'll move to the next question. Which condition can the X-ray be likely of?
It is a tuberculosis.
The time is ticking.
It is pneumonia.
That's the wrong answer. The right answer is, it's of right upper lobe lung collapse. Answer of lung collapse would also be accepted. No problem. We'll move to the next team, that is team D. Team D, are you all ready?
Yes, ma'am.
Okay. Your first question is identify the special test.
Ma'am, posterior drawer test for ankle joint.
That's the wrong answer. The right answer is it's an anterior drawer test. No problem. Identify the instrument used.
Ma'am, Theragun.
That's the right answer. Identify the part of the unit pointed by the arrow.
Ma'am, disc electrode.
That's the right answer. Okay, of which condition can the X-ray likely be of?
Ma'am, TKR.
Can you name the exactly entire full form of that?
Ma'am, total knee replacement.
That's the right answer. Good.
Thank you, ma'am.
You have scored 3 points. Congratulations. We'll move to the next team, that is Team E. Team E, are you ready?
Yes, ma'am.
Okay. So first question is identify the special test.
Ma'am, Collins test.
That's the wrong answer. The right answer is it is Finkelstein's test. No problem. Identify the equipment used.
Ma'am, it's a Tekka therapy machine.
That's the wrong answer. It is a matrix rhythm therapy machine. No problem. Identify the part of the unit pointed by the arrow.
हेड में क्रिस्टल रहता है काफी इलेक्ट्रिक सर्किट और हाँ क्वार्ट्ज क्रिस्टल इट्स अ क्वार्ट्ज क्रिस्टल
That's right. Of which condition can the X-ray likely be of?
Forget margins useful. Love feeds and large to the just
The clock is ticking.
could be of COPD.
Do we have a final answer?
COPD.
That's the right answer. Okay. You have scored 2 points. Congratulations. We'll move to the next team. Team F, are you all ready? Team F, are you all ready?
Yes, ma'am.
Team F, all the participants, only the first participant is clearly visible. All the other 3 participants are blurred. Kindly remove your background from the blur format.
बैकग्राउंड कैसे निकाले भाई?
तो आ गया ना थोड़ा नहीं दिख
अरे
रहा
वो दिख नहीं रहा है.
नहीं दिख रहा ब्लर आ रहा है दिख ही नहीं रहे
Perfect. Team F, are you all ready?
Yes, ma'am.
yes ma'am
Okay. So your first question is identify the special test being shown.
it's a form
Thomas test.
Do we have an answer?
Thomas test.
That's the wrong answer. The right answer is it is an Gansleen's test for SI joint. No problem. Identify the equipment shown. The clock is ticking, Team F.
Ergometer.
It's a GR master. नहीं wrong है.
Do we have
Balance.
one answer? Time up, team F. The right answer is it is an balance master. Identify the part of the unit pointed by the arrow. The red one. Pointed one is the red.
Ma'am, wheelchair propeller.
So what is your final answer?
Wheelchair propeller. Wheelchair propeller.
That's the wrong answer. The right answer is it is an push rim or an hand rim. No problem. Your last question is, of which condition can the X-ray likely be of?
Ma'am, it's a neck fracture of the femur. Femoral neck fracture, right, sir? Right.
That's the right answer. Team F, you all have scored 1 point. You need to go. We'll go to the next team. Team G, are you all ready?
Yes, ma'am.
Yes, ma'am.
Okay. The first question is, identify the special test being shown.
Manipulation technique.
Your clock is ticking. Do we have an answer?
Manipulation technique, passive manipulation.
That's the wrong answer. We have specifically asked the special test. It's a posterior rower test. No problem. Identify the equipment shown.
Virtual reality होती है. VR and OrthoTV.
Do we have an answer?
No, ma'am. VR.
Time up. The right answer is it's a virtual reality apparatus. No problem. Identify the part of the unit pointed by the arrow. Do we have an answer?
No, ma'am.
The pointed arrow is at a rocker of acupel. No problem. Of which condition can the X-ray likely be of?
Left
Left pulmonary edema.
congestion.
That's the wrong answer. The right answer is mitral valve replacement. So this team has not scored any points in this round. No problem. We'll move ahead with the next team. Team H, are you all ready?
Yes, ma'am.
Okay. The first question is identify the special test. Do we have an answer? Your time is ticking. Time up. The right answer is it's an Hoffa's test for fat pad. No problem. So identify the equipment shown. Do we have an answer?
Traction meter.
No, that's the wrong answer. It's a pinchometer. Moving to the next question. Identify the part of the unit pointed by the arrow. Team H, do we have an answer? Time up. It's an piston. So your last question is, of which condition can the X-ray likely be of?
Ma'am, it's ankylosing spondylitis.
That's the right answer. That 1 point just saved you. With this, we are done with our second round. Give us 1 minute to calculate our scores. Yeah. We are back. So we are carry forwarding your points from your first round as well. So team B, you all with 4 points. Team C, you all with 5 points. Team D, you all are with 7 points. Team E, you all are with 4 points. Team F, you all are with again 4 points. Team G, you all are with 3 points. And Team H, you all are with 5 points. So with this, we'll be eliminating one team, and that team will be Team G with 3 points. Congratulations, Team G, with this new learning experience. We are happy to have you as our audience. We'll now move ahead with our next round.